Call the meeting to order, being 2 o'clock. Any public comment? I did not have anyone come to me. Anyone come to you guys? Okay. No public comment. Approval of the May 5th, 2021 Public Safety Committee meeting minutes.
This is Mask, move to approve.
Asked to approve. Any second?
Risotto, second.
Motion made and second. All in favor? Aye.
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 Motion approved. Policy and discussion, potential committee determination, none. Operational functions required by statute, ordinance, or resolutions. So I'm going to group in 5A, 5B, and 6A, and turn it over to Jess and Craig McEwen for those items.
Hello.
Mr. Chair, this is Craig.
Go ahead, Craig.
Thank you. I just want to thank the Public Safety Committee for giving us and Jess and all the people that have been working on the task force for this regional morgue task force. For some of you, you may not be aware that this task force started in 2017, and we're getting to a point finally where Jess and Christina have a presentation that will outline the progress of this and the status at this time. So I'm going to ask Jessica to take that over. Thank you.
Oh, thank you very much. Do you want me to share my screen? I have a presentation. Otherwise, if you wanted to have more of an informal discussion, I am open to either or.
I guess anybody have any preferences? I would guess if you want to do the presentation, that'd be fine if you have something on screen.
Perfect. Just give me 1 second.
All right, this is Supervisor Bizzotto. I just want to interject real quick. I'm not sure how to connect using WebEx so that I can see the presentation. Does anyone, can you point me in the right direction?
Administrator Leonard will call you, Supervisor Bizzotto.
Okay.
Sounds good, thank you.
Can you see my screen? There it is. Oh, not that one. I don't know why that one showed up. Let me see why it's not letting me do this. Sorry. I'm really sorry for this brief technical issue. Share. Microsoft. All right. Can you see the PowerPoint now?
Yes, we can.
All right, perfect. Thank you. All right, so first off, thank you so much for listening to our project progress and learning a little bit more about it. I'm sure a lot of you have heard bits and pieces, but we finally are making more progress over the last few years. We actually started working on the Morgue Project back in 2014, and it was a little bit of a brief hold up. Then in 2017 is when we started the Morgue Task Force, where it kind of moved it forward a little bit. But before we get started too much, just a little bit of background information. So coroners and medical examiner offices are state mandated positions that our role is to determine the cause and manner of death for any sudden, unexplained, suspicious, or non-natural death. And then our job is also to determine if an autopsy is needed to help us determine the cause and manner of death. Forensic autopsies can help us determine cause and manner of death, any underlying diagnostic medical conditions, hereditary conditions, injury interpretation, and evidence identified and collected from that. So this is the main thing that a lot of people don't understand is the difference between a clinical pathologist and a forensic pathologist. A lot of hospital systems have clinical pathologists. However, there's very few places that have forensic pathologists. So clinical pathologists specialize in medical autopsy. So they do more of the diagnostic microscopic analysis. So if you were to have a surgery or have a condition where they do a biopsy or take a sample, it will be the pathologist that will look at that sample and then give you the diagnosis of whatever condition you have. They generally have no formal training in trauma, toxicology, or postmortem changes, and they do not necessarily feel comfortable conducting medical legal autopsies, that the autopsies these pathologists like to complete, if they even do want to complete any autopsies, are straightforward medical deaths with no criminal aspects to them. Whereas a forensic pathologist does only forensic autopsy. So they generally work for a coroner medical examiner's office or a hospital system that offers forensic pathology services, such as UW-Madison, where they do have both clinical and forensic pathologists. So a forensic pathologist has the same training as a clinical pathologist. However, they have a year-long fellowship where they conduct autopsies in a medical examiner's office, where they see about over 200 autopsies within that 1 year time frame, where they have a lot of additional training in the forensic identification, postmortem changes, trauma, criminal type cases. So they generally will do any type of autopsy that is necessary, whereas a clinical pathologist will only take on limited cases. And obviously, within our line of work, a lot of cases could easily seem to be a straightforward medical, but you never know when something will turn out to be criminal, such as someone who has heroin in their system when we weren't anticipating it at first. Any questions from anyone on the difference between the two different pathologists? All right. For local medical autopsies, that there's really no one to perform them locally. So Aspire SWASA Hospital Associates in Pathology used to perform autopsies for in-house cases and also for coroner medical examiners. A few years ago, they decided to stop offering those services, and all of their autopsies are now being transferred to UW-Madison. Marshall Medical Center does complete a limited amount of in-house autopsies. However, they do not do any cases for outside agencies or for families, that it's only their medical cases that they do. So for forensic pathologists in the state, there are only a few locations in the state that have forensic pathologists. They're located in Dane County Medical Examiner's Office, Fond du Lac County Medical Examiner's Office, Milwaukee, Waukesha County. Waukesha County does not do referral cases, though. They only do their own cases. So by what we mean by referral cases is the other cases, the other counties, and also UW-Madison accept cases from coroner and medical examiner offices, where Waukesha County does not do that. So virtually there are only 4 autopsy providers currently in the state. So when we are doing our analysis and talking to different counties around the state, these are the counties that have expressed interest in coming to our facility and utilizing our services, which is quite a few. We also had a few counties in the Upper Peninsula, Michigan, interested in utilizing our services. However, they did not respond back with our last round of surveys due to a lot of staffing changes, so we did not include them in the finalized numbers for the business plan. All right. So why is Marathon County an ideal location for this type of facility? The main reason is we are centrally located in the state. It's easy access through Highway 29 and Highway 51, which would reduce the commute for all of the surrounding counties that we have identified. All of those counties have to physically drive through Marathon County to get to the forensic pathologist. Even the counties to the south of us would have a reduced travel time to our office. We are very fortunate here that we have a crime lab of Wisconsin, their northern office located in Wausau, where the other locations are in Dane and Milwaukee County. They are very excited if we could ever get this type of facility here, just because a lot of their technicians are not able to follow the case through, because when we go down to autopsy, the Dane County office is typically there, so they're not able to see the autopsy and the final cause and manner of death ruling. The Department of Criminal Investigation, DCI, also has an office in Wausau, Their other locations are Appleton, Eau Claire, Madison, Milwaukee, and the Milwaukee region, and Lake Winnebago region. They too are excited to have a local facility if this could get approved, as their local office agents, their officers are able to come to our facility to watch an autopsy instead of, again, handing it off to another office and not being able to see the case through. It makes it a lot more convenient for their staffing. We have a lot of other community resources that make us an ideal location. Numerous colleges and universities, including the Medical College of Wisconsin, who has their other locations in Green Bay and Milwaukee. Our hospital systems, Marshall Medical Center, Marshall Clinic, Aspire Swassa Hospital, and we also are the largest county in the region and the largest medical examiner's office, where we have the staffing and resources to support this type of facility. So this is just some background information of why we need a morgue in Marathon County. So the biggest thing is mass fatality management. There are multiple different types of mass fatalities. And the funny thing is this was created prior to COVID, where that was always a concern of ours. And after COVID, it really highlighted the need for the epidemic. But we can have a criminal type mass fatality incident, can be criminal accidental, which is like a mass shooting, a vehicle crash, environmental tornado flooding, severe weather, and then also the pandemics that we had recently with COVID, and we got to see the effects of that. In these types of situations, the coroners and medical examiners are responsible for body storage, both short-term and long-term, of figuring out what to do with decedents, body transportations from scenes to holding area to a morgue, and then a facility to conduct autopsies and where that can be done. Right now, at the start of COVID, we are very fortunate where we got an in-house cooler where we are able to store 9 bodies comfortably, but we could go up to 10 if absolutely needed. And we are the only county in the entire region that has any type of coroner, medical examiner, county-owned decedent storage. A lot of times, coroners and medical examiners are reliant on hospital systems for body storage, and in our situation, Aspire Swassa Hospital has very limited storage. They've throughout the years only had 2 places for decedent storage, and more recently got a little racking system where they can store up to 4 decedents. However, they're a busy hospital, and many times their cooler space is covered. And then Marshall Medical Center Weston also has limited decedent storage. Actually, during COVID, we had contracts with both hospital systems to be an overflow storage site in case if they were to need additional body storage. They did not need it, but one day came close to needing it by being filled at their facility. So attending autopsy is another huge struggle for our office, that we have no local autopsy providers, that all of the providers are in southern Wisconsin or Minnesota. So we are currently spending over 2 hours travel one way per autopsy, and then it's also a further commute for the northern counties. We did a time study with Molly a few months ago, which revealed that we are spending over 500 hours of unproductive time per year traveling to and from autopsy, which is very significant for our county and staff. And then transportation of the decedent, we have 3 county-owned vehicles. The majority of counties besides us who do not have county vehicles rely on funeral homes and livery services, which are an additional expense to them. And they're difficult to arrange as well. Pathologists have an increased caseload, and it's been more difficult to get in same-day autopsy, and it's only getting worse, which we can go over a little bit more later. Which the delay in autopsy, your toxicology might not be as accurate, and the law enforcement district attorney would like results right away as well. There's also a delay in releasing the decedent to the family, which is difficult for families not to have the answers right away, but depending on how long of the delay is, you may have embalming issues for viewing if the person starts having postmortem changes, or if it's for over a week to try to get in. And then most cases require law enforcement to come with, so it's difficult to coordinate an officer or detective to be gone for 8+ hours, and the drive time takes away from investigation time. Another issue that we have is we have no place for families to spend time with a loved one. that there's limited space for families to view decedents. Like currently, if the person were to die in the hospital or emergency department, they do have space. It is not an option for outside facilities, and it only is available if circumstances allow for that particular situation. However, both of the hospitals can be very busy where that might not be an option. They do have holding areas, but again, it is not a good experience for families. Those rooms are cold, they're cooler, they're not made for families to view decedents in there. And there's no way for us to make that body look presentable to the family without having more supplies, equipment, place to bathe the decedent, anything like that. And the main issue why this is important is if families are not able to view decedents in some situations, it does hinder their cultural and religious practices for the family, and it can be very upsetting to the families and a bad community service if we're unable to accommodate this. And sometimes we do need to have families view for identification purposes. So it's not necessarily the families wanting to view, but it's more that we need the assistance to get that taken care of. And then tissue procurement is another thing our office is very passionate about, that currently just under 60% of Marathon County residents are registered tissue donors. One donor could impact more than 50 different people. So currently in Marathon County, there is no designated facility for tissue donation, that the procurement agencies are at the mercy of the local hospitals and funeral homes to conduct their procurement procedures there. Which makes it a little bit more challenged that they're unable to satisfy decedent family wishes for donation, and then family can lose out on an opportunity of follow-up and grief support. That also, sometimes there are also certain restrictions that our office may have with tissue donation. If it is a suspicious death, there's a lot of trauma that we need to document prior to autopsy, or infant child deaths who their heart valves are very valuable for donation. The other big restriction we have is traveling to autopsy, that there's no refrigeration at that point, which may disqualify some donors from being able to donate at that point. Their requirements are very strict as to how long the decedent can be without refrigeration. And then lastly, some funeral homes do not have refrigeration. Is there anything you can add? All right, so benefits to the community. So there's a lot of benefits of having a local forensic science center here in Marathon County, but mostly for the family, which is the most important because that is who we serve the most. So they would have improved service, ability to meet with the pathologist and discuss the autopsy results in person, an option for local private pay autopsies for situations where our office might not deem it necessary. However, they would like an autopsy done for family history purposes. And there's also an option for organ recovery for research, which we actually had a phone call about this yesterday, so there is a very large need for that in the region. And then a limited delay of autopsy where they would be able to release the decedent to the funeral home and loved ones sooner, and an improved turnaround time on case reports. Most of our pathologists do a really good job of getting the case reports done in a timely manner. However, as caseloads increase, it gets more difficult for them to get it done. And I know some other offices around the state do struggle to get their case reports done in a timely manner due to the sheer volume of cases. We would have a family room at our office, which would be the appropriate place for us to meet families that would meet trauma-informed care standards, and it is also a quiet room to do interviews and discuss results for families. We'd have improved qualification for organ donors, that we would have some of the limitations would be reduced by having a local facility here, and then which they do wonderful grief support, family follow-up for family members. And then enhance autopsy services, that we would be able to conduct more autopsies up to national standards, which would have increased diagnostics of hereditary conditions and improve closure to families. So the Marathon County benefits, not just our families, are enhanced educational opportunities, that we would have the ability to view autopsies for educational purposes, for different law enforcement, EMS agencies, different technical colleges, monthly in-service training to all related agencies. So it could be regional coroner medical examiners, our local law enforcement, and also EMS. and hospital staff members as well. And then we would like to do at least one yearly death investigation conference for the region to provide a little bit more continuing education, and having the forensic pathologist expertise local, which is very important. There'd be increased travel and business to Marathon County, that more people would be coming here, so obviously stopping for fuel, restaurants, hotel at times. There'll be an increase in funeral home trade call business, where when decedents are in Marathon County, a lot of other funeral homes call upon the local funeral homes to assist with removals, embalming, different types of services. And then the job growth, that we would be increasing more positions with our facility. Forensic consultations to local departments is also very important, that the forensic pathologist does have a lot of training in injury identification, sexual assault type cases, different child abuse situations, where they can, if someone is a victim of any of those type of situations, the forensic pathologist will be able to do consults on living people, not just the decedent. And then the forensic pathologist would also be able to go to complex death scenes, which is much better than us trying to show what we're trying to see on pictures, to actually have the pathologist at the scene, see the decedent where they are, and learn the full scene circumstances prior to autopsy. Regional benefits are having a morgue in Central Wisconsin is going to be a cost savings to all community partners. They would have a lot less reduced travel time, a lot less staff time, and ability to conduct more autopsies due to convenience. One of the trends that we had when doing a lot of our county interviews was the fact that they are not doing as many autopsies as what they would like to do, based upon the travel time and a lot of the obstacles to get to the current autopsy providers. But all the counties, well, I shouldn't say all, most of the counties did express that they would like to do more autopsies having a local provider. Having the local forensic pathologist would be enhanced educational opportunities for, like I said, law enforcement, EMS, and then healthcare professionals, forensic consultations to different departments, and it could even be outside of Marathon County, and then local forensic expert testimony. Every time we have a case that's going to be prosecuted, we always have to set up meetings with the forensic pathologist, and those meetings can be very challenging, not having the forensic pathologist with us, where they can see what pictures we're talking about and going over some things in person compared to on the phone. And then enhanced prevention services for child or suicide prevention, child death, and drug and alcohol, and also improve community service by having a local pathologist. And then the regional benefits are the mass fatality, refrigerate 20 plus decedents at a time for mass fatality, also having a freezer, and then biosol services, and then assist in mutual aid response. Obviously in Marathon County, we have a lot more resources than the smaller counties to the north of us, where they could really benefit from having mutual aid and having a place for decedent storage. Our goal of the facility is to be a regional asset, and then also to have a secondary decontamination area, and then short and long-term body storage, that where we can maintain chain of custody and assist with unideal cases, such as cases where there's postmortem changes where we couldn't take them to the hospital. Other counties would have that opportunity to come to our facility as well. All right, so where we are with the Forensic Science Center project. So as Craig had said, is that the Morgue Task Force was created August 2017 and is overseen by the Public Safety Committee, and is chaired by Craig McEwen. Their initial form of business was to oversee the development of the business plan, which we have completed, which we'll go over soon, and identify long-term goals and strategic short-term plan for the project. So right now we are meeting on a quarterly basis as needed, as different things progress with the project. So we had a very basic morgue facility needs idea of what we would want in our facility. We will be doing a more formal space needs that I'll discuss next, but overall we would need office space with storage and reception area, a family room. The morgue would have 2 open autopsy suites, 2 separate closed autopsy suites with negative pressure. Negative pressure is very important for cases if there is any risk for respiratory type droplets or different types of disease processes such as COVID, tuberculosis,
Tuberculosis.
Thank you. Or anything like that. So it is very essential that we do have negative pressure. A morgue consultation room where the pathologist would meet with the different counties coming in, our investigators, an examination room where we can conduct body examinations separate from the autopsy area, walk-in shower, cleaning room for our cots, walk-in freezer, and walk-in refrigerator that can hold up to 20 bodies at the minimum. Additional features would be a drive-through garage for loading decedents, 4-car, 2 stalls with entry into the morgue, and then 4 covered parking spaces for county vehicles, generator backup, in-floor scale, portable x-ray equipment, and HVAC system. So our next step is to do our space needs analysis. So we just hired Somerville and accepted their bid to complete the space needs analysis, which should be completed by the end of June. So the space needs analysis is going to actually tell us exactly how much square footage we would need for a facility, give us a very accurate construction cost for remodel and a construction cost for new construction, and then the design fees as well of how much getting those finalized designs would cost to complete the project. All that information is essential for us to help determine our location of the facility and the costing for that. And then back in 2019, Agnes Young completed a preliminary space needs analysis. They estimated our gross square footage for all of the stuff on the previous page to be 14,000 square feet with a net of 11,000 square feet. Since then, our needs have slightly changed, and Agnes Young also has never built a morgue in the past, so we're excited to work with Somerville. They just completed the Brown County morgue area and also the Dane County morgue area, so they've had 2 morgues that they've worked with. Another thing that we did as part of the business plan is we did a very extensive comparable county analysis. So what we had done is looked at the counties within the Midwest, and then we eliminated all counties that had a population above 250,000 and below 100,000. So that left these counties that are listed, besides the ones in Wisconsin, obviously a little bit higher. It's the ones on the similar population county. And of those counties, we interviewed all of them to determine what is the more comparable county structure to what they have for operations to what we have. So we identified St. Louis County in Minnesota, Minnehaha County in South Dakota, and Fond du Lac County in Wisconsin. These 3 counties were our comparable counties where we extensively reviewed their financial, staffing structure, community partners, and any advice that they would have for us. We also talked to the Wisconsin counties with forensic pathologists, which was Dane, Milwaukee, and Waukesha. And they were able to provide some additional information. But again, those counties are much larger than ours, and their staffing needs and operations are completely different. So St. Louis, Minnehaha, and Fond du Lac were much more similar for that. We also spoke to Versing American Tissue Service Foundation about their needs for our facility, and they're looking to partner with our office to have a regional center for tissue procurement services. Versity currently has that set up with the Milwaukee County Medical Examiner's Office, where instead of their staff, currently if there is a tissue donor anywhere in the state, that both ATSF and Versity would send their tissue procurement team to the decedent, so the team is consistently traveling and having to travel with all of their supplies and also travel back with all of the specimens that they would take from the procurement procedure. And they're going to different locations, so they might be at one hospital one day, then a different funeral home a different day, and then a different funeral home the next day, so it's very difficult for them. So what they would like to do is to have a dedicated area for tissue procurement where the decedent would travel to them, and then they could work at that particular location instead of going to the different funeral homes and hospitals. That would definitely streamline the process for them and also allow for additional tissue donors to be additional decedents to become successful tissue donors. Sorry, I can't talk. There's also benefits to Marathon County for having this partnership, that it would be a revenue source for the facility rental fee, but the most important thing is it does improve regional tissue donor opportunities. For the families, they would be able to have more local follow-up care and grief support and an increased opportunity for tissue donation that a lot of the time restraints could be minimized by having this type of partnership in place, especially for scene deaths from coroner medical examiner cases that we have a lot of time restraints, but having this partnership and having a dedicated place for tissue donation would increase the opportunity for people to be successful. Community would have community outreach efforts and events, community partnerships with the agencies. They already have it with the hospitals and the Medical College of Wisconsin, but they talked about wanting to partner more with North Central Technical College, especially the surgical tech programs, to have more awareness of transitioning into tissue procurement services as a potential career. And again, there'll be increased travel. It'll be increased local funeral home business and increased travel to our area for trade calls. So the Medical College of Wisconsin is also looking to form a partnership. They would like the students to have an opportunity to observe autopsies for extra credit. They have a similar arrangement with the Milwaukee County Medical Examiner's Office, and currently there's nowhere in Marathon County for their students to observe autopsies. They also have a need for additional educational services from the pathologists to teach medical students, as they have a difficult time finding pathologists willing to teach, and also have additional educational opportunities that might not revolve just with the pathologist, such as formalized death certificate signing training that doctors typically do not have. Aspirus, Marshall Clinic, and Ascension are all supportive of our initiative. We have been in a lot of conversations with Aspirus and Marshall Clinic over the last few years regarding forming a partnership. Both healthcare systems are interested in forming a partnership with our office, and both have actually identified potential locations at their facilities. Right now, the Aspirus location is a little bit more ideal than the Marshall Clinic location, just because it does not involve as much renovation. So we are right now looking into the Aspirus location for the facility, and also a standalone building that would be 100% county owned. But there's a lot of benefits to having a partnership with both healthcare systems, such as the local medical autopsy provider that we could do. We would provide delivery services to the hospitals to help transport the decedents from their facilities to our office, additional body storage as needed, mass fatality preparedness, a family viewing area, or family consultation room if they need it, and then student resident teaching opportunities. We also would benefit from having a partnership to have histology slide preparation, cultures and different type of blood work completed at the hospital systems. And another big benefit would be the assistance with recruitment and retainment of the forensic pathologists, that both healthcare systems have expressed interest and willingness to help us with those measures. So the business plan, we started working on the business plan in 2018 and completed it November 2020. It is exciting. We are cash flow positive, meaning that we would be operations neutral. We still would require the same tax levy that we currently do, but we would not require any additional tax levy based upon our projections. And eventually we would be able to reduce our tax levy as time goes on. With the business plan, everything was completed. However, we did not have a location, finalized construction costs, and a few things else that need to be updated. So within the next few months, after we have our location identified, know our exact construction costs and updated financials, and exactly what partnerships we have, we will do one final update to that business plan. So the cash flow analysis that I briefly talked about, that they have into 4 subcategories: the low, mid, high, and high. And then based on all of these were based upon the responses from our county surveys. And that was when we were contacting the different counties to see what autopsies they would need. Our range between autopsies was 209 and 597, which is quite a significant range. Our consultant was extremely conservative in his numbers, so we believe we would be somewhere between the mid and the high. Most likely the mid-high is our most likely level. With all of that, the staffing needs would be 3 to 6 full-time positions, and then 1 to 3 of those positions would be forensic pathologists, and then 4 part-time livery drivers. We would have a lot of different revenue streams coming in from autopsies, our livery service, our facility rental fees for tissue procurement, and also other services such as organ extractions for research, and a few other things. We'd have a lot of expenses though, such as supplies, equipment, maintenance fees, histology, and miscellaneous costs that we put into the business plan. Oh, sorry. So we're operations neutral. Like I said, additional revenue would be between 50 to 100,000 per year. That does not include all numbers yet. That unfortunately, though, we're unable to recover the debt payment for the construction. This was based upon our old construction numbers, which they've all have gone up since then with COVID and everything else. But we should have updated numbers soon. But the potential to cover costs is established partnerships with Portage County, which we have a meeting scheduled later on in the month with them, and then partnerships with Marshall Medical Center and Aspire Sosa Hospital, a campaign to help lower some of the construction costs, such as seeing if any of the local community foundations would be willing to sponsor certain areas of our facility, such as a family room, a conference room, or teaching studio. And we also are looking into different grant fundings as well. The difficulty we're having with the grants right now is a lot of them have requirements that we need to be an accredited facility to qualify for the funding. And unfortunately, we will not be able to be accredited prior to the facility being built and the end of the grant cycle. So a lot of those are no longer an option. We're also hoping that potentially some of the COVID funding that's coming could cover aspects of the facility as well. So we will see what Christy and her team learns. But where we are right now is that, like I said, we just hired Somerville to do our space needs analysis. We should be getting started with that in the next few days. It should be done by the end of June. The space needs analysis is going to give us a really good idea of how much the facility is going to cost and help us determine where the location is going to be. After we have all the numbers, we will do an analysis between the space at Aspirus and also county-owned. We're looking at both angles to see which is the most cost-effective long-term for the county and most sustainable long-term. Once we determine our location and facility design, it's the one thing with location is it needs to be easily accessible to resources and to the highway system primarily, and also ideal to be close to existing county structures, just because if we are in our own standalone building, we would need someone to come and do snow removal, different types of outdoor services, which if we are completely away from that, it would be a little bit more challenging. And then the facility needs to meet current and future needs. Once we have the facility needs done, updated construction costs, we'll update the business plan and financials. We're going to also continue to explore funding opportunities. We are moving forward with the CIP request as long as you guys are okay with us moving forward to that. After the CIP approval process is going to be contingent on the full county board approval, which we hope to have in 2021. The original CIP request that I submitted was to have some of the studies done in 2021 for the architectural studies and also purchasing that condo unit at Aspirus if that is the route we decide to go. However, based upon a few changes, we're not quite sure if we will be pursuing that this year or if that would all be part of the 2022 CIP budget. So as we progress, some of those timelines will be able to be finalized a little bit more. Is there any questions or comments?
This is Supervisor Mask. I was wondering, is there a difference between tissue procurement and organ procurement for organ donation? What is the difference, if there is any?
Yep, so there's actually a very large difference between the two. So for someone to be qualified as an organ donor, they typically need to be in a hospital for a prolonged period of time where they're able to do extensive studies to see if that person does qualify by looking at the different organs, the tissue to make sure there's no communicable diseases, and to make sure everything is feasible for transplant. And then that person, to be a successful tissue donor, would need to be declared brain dead from studies from the physicians, or they could do donation after cardiac death. So if the person is deemed not to be survivable, they would need to go to the OR, and then they would remove all life support measures at that point, and they have to pass within a certain amount of time for them to be able to be a organ donor. So very few people actually qualify to become an organ donor each year. However, a tissue donor, the difference is that the person does not meet any of the communicable disease requirements or certain medical history such as cancer, HIV, dementia, a few other conditions. The person has to be in refrigeration within 12 hours of their last known alive time. Or if it's over 12 hours, they need to do the donation within 15 hours of death. If it is refrigerated up to 12 hours, they have up to 24 hours to do the donation.
So basically, organ donation will take place on an individual while they still have a heartbeat, where tissue donation can take place on a lot of our deaths that occur outside of healthcare facilities. So somebody that passes away at home, as long as they meet the time frame requirements.
Thank you very much.
Mm-hmm.
You're welcome. Any other questions?
This is Craig. Can you hear me?
Yes.
Thank you. And again, I just want to thank Jessica and Christina and the task force. There's a lot of obvious benefits to Marathon County, not only to local law enforcement. It wasn't an opportunity, but I had to attend an autopsy down in Milwaukee when I was working as a police officer, and it was all day, and it was a suspicious death, and without that autopsy immediately, which was done the next day, it was determined that it wasn't suspicious. But there's definitely a benefit for all local law enforcement, not just the sheriff's department, and to the law enforcement agencies in the other counties. Plus the benefit to the victim and more importantly the family, with the opportunity to share some time with the victim and not traveling to Milwaukee or Madison, which makes it very difficult. And like I said, the tissue donations would probably be more successful. And like I said, there are a lot of benefits. And I'm just going to refer to the strategic plan, which the Public Safety Committee's lead committee for 7.1, which is provide cost-effective and high-quality public safety services. And this definitely falls into that category. So, like I would hope that the Public Safety Committee, would support the CIP request, and it's going to come this year. Things are going to happen very quickly. I think when we, identify a location, and I know Lance has been involved in this for a couple of years now, and I don't know if he's got any updates, but there are some legal changes that we met with Pat Snyder about costs for death certificates and different things like that. But I don't know if Lance, you got anything to add to this?
Sure. Thank you, Craig. Just to summarize, I think Jess did a very good job, and if you have any questions, please reach out and we can try to ask them. But, I think one of the tactics the task force has
taken and staff have attempted to follow through on starting in kind of early 2020 was kind of re-examining the 5 duties and responsibilities of that task force. Number one, I think we always had a good handle on, which was quantify the need for autopsy facilities and the staff to perform them. That is set forth in that business plan, and that's a pretty straightforward analysis. Number 2 is identified the need for storage of human corpses under normal circumstances and in large-scale emergencies. Again, I think we've had a pretty good handle on that. The task force directed staff's work there quite well, and in fact, as Jess alluded to, in 2020, we were able to take and identify some funding resources to move forward with that outside of the regional morgue process, so we have some of those resources now. But really, with respect to duty and responsibility number 3, the identification of partnerships needed to make a regional morgue work operationally and financially, we really expanded the way that we were looking at that. And my experience with respect to intergovernmental agreements is not overly vast, but if you look at the intergovernmental agreements we have here in Marathon County, the agreements that create city-county information technology, or that create North Central Healthcare or Central Wisconsin Airport, those are agreements that we enter into with other counties. And fortunately, we have Portage County, who has been very active on our task force in terms of membership and attending meetings. But one thing we started in 2020, I asked Jess and Christina to really let's re-examine our opportunity that we have in this community to try to partner with our medical systems. And to their credit and to Craig's credit, we really have hit that quite hard. And it's not something that we're overly familiar with. Again, we have a lot of intergovernmental agreements with other counties, other governmental entities, but not so much with medical systems. But both Aspirus and Marshfield Clinic have come forward. We also have had the ongoing discussions with the Diversity organization that Jess has referenced. So it's a bit more complex than your run-of-the-mill intergovernmental agreement, which is in and of itself complex enough when you're trying to talk about what does your partnership look like. The other thing that I'll say that adds a little bit of complexity to this, if you look at Central Wisconsin Airport, for example, it's a tailor-made intergovernmental agreement because the airport doesn't cost any tax levy. They do their thing, they make their money, and they fund their projects. Essentially, all we do on occasion for them is we serve as a source, a conduit for bonding, either us or Portage County. This is going to be different. As Jess alluded to, the great news from our initial projections is if that things work out well, this should be operations neutral, but it's operations neutral from an already negative tax levy perspective. And Portage County, similarly, their coroner's office has tax levy going into it. So this isn't an occasion where you form a partnership to say, hey, we're all going to make money in this deal. This is a partnership where we're coming together and we're saying, hopefully we break even or maybe make a little money. But if things don't work out, there is risk to these partnerships. So really trying to identify, number 3 is what does that partnership look like? Is it a true joint venture with another county? Or is it a contractual venture with other counties and other non-governmental entities? This is a bit more complex, as I said, than some of those other entities that we've formed. So it's been a lot of work, and it feels like, I'm sure, particularly for Craig and for Jess and Christina, it feels like it's taken forever. But I think, as Craig alluded to, in the second half of this year, we should learn some really important kind of determinative information. We'll start to better understand what is the true cost of construction in the current environment. We'll understand what is the true cost of the property that Aspirus has identified for us in that condo association, because that's the other wrinkle here. This isn't, as Jess alluded to, we have an option on the table that's not the traditional standalone county-owned facility. It's buying into a condo where we still own the facility, but we do have some costs that are going to be part of a condo fee, like the maintenance that Jess alluded to for the exterior of the building, those sort of things. So it's a bit more of a, we need to learn more there and better understand that, but the two items you do have before you in today's agenda are those CIP requests that Craig alluded to. And I want to be very clear, like both Jess and Craig have stated, approving these today does not mean that the county board is going to be spending the money identified in the 2021 CIP request or the 2022 CIP request without further action from the board. The board did approve a budget transfer within Jess's budget for initial preliminary design, which is referenced in the packet materials. It's on page 11 of 54, the preliminary design study cost, initially projected at 15,000. That's going to be less than 10,000 from our current quote from Somerville. And the county board did already approve an internal department budget transfer from within Jess's budget to move forward with that. But that's just the first step in this process. All the future work would come through the appropriate committees and be approved. So this is really kind of laying a roadmap out for you and your approval of each of those projects to move forward. One in the amending the 2021 CIP plan, and the second recommending for inclusion in the 2022 CIP plan are really that first step. So I hope that was helpful. Craig, if you have any other thoughts and things to hit, I'd be happy to do so, but I know that was a lot for the committee to take. The task force has been working on this for a couple of years, but it thought it was important to get in front of the Public Safety Committee based on your reporting relationship.
Thank you, Lance. I just want to emphasize the contractual agreement. We have that type of agreement with the juvenile detention center where other counties reserve bed space or for juveniles that they have to bring there, and that's kind of what you're referring to about having some kind of contractual agreement with other counties, because they're going to have autopsies that unfortunately they're not going to go away, and they're going to need a facility, and I think there is a situation where we did that with with our juvenile detention center. Thank you.
With that, I guess we would look at 5A and 5B, and what would the will of the body be?
This is Supervisor Mask. I don't have an agenda in front of me, but I will move to forward this to CIP. Is that appropriate?
Yes, it would be, and it would be to recommend to amend the 20, do you want me to read it verbatim?
Yes.
Okay,
please.
recommend to amend the
enough
20.
to go into the,
What's that?
just enough to go into the motion.
Okay, it's just basically to amend the 2021 capital improvement program to add regional forensic science center project, and then it also would add the 2022 capital improvement program request for forensic. So it would be for 2021 to amend it and then to put it in the 2022 CIP program.
Okay, thank you very much.
I'll second it.
All right, Supervisor Mask with a motion and Supervisor Lamont with a second. All in favor? Aye.
Aye.
Are there any opposed? All right, motion carried. That will be sent to CIP. Thank you. With that, and thank you very much, Jess, and what was it, Christine? Is it Christina? Thank you very much for your presentation. And then with that, we'll move to 6B. So everyone has the packet. I'd like to just gonna make it real quick. We were supposed, just so we know, next month we will be 1:30, not 2 o'clock. small oversight, not a huge deal. So next month we will be at 1:30. But if you look through the packet, I'd like to make a couple notes, I guess, and then a couple comments. Brent Jacobson could not attend today. He had a prior engagement with his work. So I'm going through here. So if you look at your system budgeting memos, we have several there that are that Lance put in the packet. Or so there's a couple things that actually Brent Jacobson and myself actually met with Teresa today, and we discussed some things. What our plan is moving forward is we're probably going to, I'm going to make a quick announcement at the June meeting, because both Supervisor Jacobson and myself said we would have some sort of report out for the full county board. We're going to ask to expand it to July, just because there's a couple of things we'd like to button up before we bring that forward. One of the things we'd like to, per our discussions today, and some of the things we've learned, and is that this Superion and then the Protect, how they're going to hook up, is one of the things Teresa brought up today. I thought that was fairly important, that I'd like to get that on our at least in our report. Some of the other things we discussed today, I'd like on the report, but then also in our memos, for the electronic calendaring, I would like some further clarification on memo from Clerk of Courts Shirley Lang. That's not exactly correct, the memo, I guess, so I'd like to have some more, and I will be talking with Kelly Shrimp. She's on the call, so I'll be talking with her later about that, maybe later this week, just to see where we're at on that. And then I'd like to actually sit down with some of the players again. But yeah, that's the main thing, that I just wanted everyone to have the memos, to look what they've been, some of the things that have been brought forward. And I guess I'll turn it off real briefly to Lance. Some of the things you would like to add.
Sure. The only other thing I know we discussed that is going to be important for this committee is position discussions, prioritization. We had a brainstorming event at the kind of onset of this process, and identified potential positions to that would be of value in the criminal justice system. And I think there's certainly value to all the positions that were brought forward, but certainly two that were identified that I'm going to be working to incorporate into the administrator's 2022 budget. The position, the dispatch position, to open another dispatch channel. There were two positions right at the top that people indicated needed to be funded. The dispatch channel position was one, and the second position was legal assistant position within the district attorney's office. So I'm working I will be working when we begin in earnest the budget process of putting those things into the budget.
And it'll also do note that both Supervisor Jacobson and myself will be meeting with Lance to go over some of the things that we've learned, he's learned, the parties involved, obviously, and then come forward with, like I said, a kind of an overview of what we learned through this whole process, and moving forward, how we're going to do it. Yeah, also notably, I guess we wanted to get it in June, but I'll be honest with you, with some of the things going on at the county right now, it's the workload's pretty hefty, I will say. So I think everyone will understand why we're going to just postpone it one more month. But with that, any questions of me from this body? All right. If not, next meeting time, location, announcement, agenda items. Committee members are asked to bring ideas for future discussion. Next meeting will be Wednesday, June 30th at 1:30. It says 2, but it'll be 1:30. Any other things committee members would like to bring up? All right, if not, I will take number 8. Nobody wants to leave the meeting? It's very exciting.
Lamont moves to.
Supervisor Bizzotto with a motion to adjourn.
I'm out with a motion, Bizzotto with a second. And all in favor?
Aye.
Aye. Any opposed? Motion carried. We will see you all actually at the county board meeting. All right, thank you.
Thank you. Sounds
you.
good.